Whether you're currently in a dental hygiene program, you're a new grad, or you've been practicing for a while and you're thinking about furthering your education, you're in the right spot. When I first started researching bachelor's completion programs, I was a little overwhelmed by the options trying to compare program to program. But after doing some research into two 100% online bachelor's completion programs here in Minnesota, I found some key differences that might help you make a decision. So that's what I'm here sharing with you today. And if you're a Minnesota resident, you actually might be able to get your bachelor's for 100% no cost. That means not only will you have the career opportunities that come along with a bachelor's in dental hygiene, but you won't have to sacrifice your time sitting in a classroom or your money to get your degree. And there's one program that has something that could be the make or break thing when it comes to your decision. So stay tuned and I'll tell you what that is a little bit later. So the two programs that I'm going to be comparing today are Metro State University in St. Paul and Minnesota State University Mankato in, you guessed it, Mankato. If you want to expand your career without leaving clinical work, a bachelor's degree could give you options that you might not have considered. And in doing my research, I think that one of the best things about a bachelor's completion program is that it will help you to stay relevant and up to date on your field. I don't know if anybody can disagree that if you have an associate's in dental hygiene and a bachelor's in dental hygiene, the person with the bachelor's is probably just going to have more knowledge, right? Because they just had more schooling. Not to say that one is better than the other, but more knowledge hopefully keeps you more relevant and helps you keep up to date with what's going on in that current time. And a big advantage of staying relevant and advanced in your field is that can open up doors for you in corporate and leadership, maybe in something like sales, marketing, and whether it's burnout, an injury, or just wanting to pivot. When you have a bachelor's degree, you have more options. So when it comes to these two programs, Metro State and Mankato, I can't tell you what the overall key goal of the program is. I can look at the course descriptions from, morning to night, but I'm not the department head. I bet if you sat down with the department head, they could probably tell you the key goal in a super succinct sentence. They might even be able to compare and contrast their program with the other one. But, I'm just one person who's looked at the programs, and I'm just here to kind of highlight some similarities, some differences, and some things that seem to be unique to one program or the other. And hopefully you can use that information to make a decision that sounds and feels right for you. So Metro State has 7 courses that are dental hygiene focused, and then there's 3 supporting courses. One is statistics, one is writing in your major, and another one is medical ethics. Now, when it comes to the writing in your major, there is a prereq for that class. Don't we love the prereq to the prereq? And then for medical ethics, there's no prereq for that one, but there is something that I should mention about the writing class. That is a prereq for almost all of the dental hygiene courses. So you do have to start by taking that writing class, and if necessary, a class before you can start there. When it comes to Mankato, they have 11 courses and only one of their courses is a prereq for the other courses, so you can get started. It seems like a lot quicker. Let's start with the similarities. There are just a few similar courses. At Metro, we have Dental Hygiene 310. At Mankato, we have Dental Hygiene 442. Metro, their course is understanding current and relevant practices in oral health care. Mankato is expanding oral health services and current legal and policy issues impacting dental hygiene. So the next course at Metro, Dental Hygiene 320, it seemed to fit 2 different courses at Mankato, Dental Hygiene 444W and 454. Metro describes their course as a deeper understanding of the dental hygienist role in oral health care delivery. And for Mankato's 444W, it's described as leadership preparation in delivery of oral health care in a public health model. And then 454, it's demonstration of oral health delivery in community-based clinics. Now, there's something to note about this course and one other course, and that's that these 2 courses require malpractice insurance. Now, is it just me, or is it kind of weird that an online course requires malpractice insurance? And also the wording, delivery in community-based clinics, makes me think that that's not quite online. So I'm definitely gonna have to dig a little bit deeper there, figure out what is actually expected of you, because again, malpractice insurance for an online course. It's just like really not making a lot of sense to me. I'll reach out and email somebody at the college. Once I get a response, look in the description box or maybe as a pinned comment. I'll let you guys know what I hear when I hear something, because that's really strange to me. The next similarity is Dental Hygiene 410 at Metro and Dental Hygiene 451 at Mankato. So at Metro, their class teaches you how to make evidence-based decisions, and Mankato seems to focus on treating maybe medically complex patients using that same skill set. There were a couple of these courses, I'm not gonna say a couple, I would say the vast majority really didn't match up like very well at all. I kind of had to stretch and kind of find keywords and use what I'm learning about in my second year in dental hygiene school to try to figure out what exactly is being taught. And this is just like my best guess. I really don't know for sure. Definitely double check what I'm saying. If you realize anything is incorrect, put it down in the comments. Let me know. I'm happy to be corrected on anything that I'm not right about. And the last course or couple of courses that I found were pretty similar were Dental Hygiene 340 at Metro and Dental Hygiene 445 at Mankato. And I would say basically at Metro, this class is just teaching you how to be a teacher. They do say that it includes classroom assessment techniques. Now, Mankato, I would say something that's notable about this course and that's specifically different from basically the teaching you how to be a teacher course at Metro is that at Mankato, they say emphasis will be placed on competency-based instruction. Now that to me, just being a student, means that's more of teaching you about how to be a clinic instructor. I feel like when I'm being tested over calc detection, Gracie, those are competency evaluations. That's what I understand them to be. That's kind of the verbiage that my school uses. So it kind of seems like at Mankato, they are focusing more on teaching you how to be a clinical dental hygiene instructor. And at Metro, they're maybe focusing on more, or at least focusing on and including how to be a classroom instructor. Now, for me personally, I've always said I'm not a teacher. Like, I'm just not a teacher. I think it takes a special kind of person to be a teacher. I don't think anybody can just say, I want to be a teacher and you're specially suited for it. I know it's not for me. Now, when I think about classroom instruction, I'm still a hard no, like it's not for me. But when I think about maybe 10 years down the line, after I've had a ton of clinical experience, I've done volunteer work, I've done so many things, and maybe I want to pivot. When I think about clinical, I feel like, okay, maybe I could do that, I feel like it's like a maybe, right? I don't feel like I'm excited about it. I don't feel like it's a definite like retirement plan. I just think like clinical teaching, like, okay, it might be something that I could do. So that for me personally kind of has me leaning towards Mankato, because if you're teaching me about how to be a classroom instructor, it's useless. Okay, so moving on to the classes that were like unmatched. Each college had a couple. For Metro, they had Dental Hygiene 300, which was designing and managing teams. Now, believe it or not, I am not a leader. I'm more of a team player, a follower, if you will. So I have no interest on how to design or manage a team. That's not for me. It truly isn't. Now, along with that, one of the supporting courses that I was mentioning would be that medical ethics course. And I would say that that is crucial. But you have to keep in mind that it's a medical ethics course. It's not a dental hygiene specific course. And I want to learn about the ethical parts of dental hygiene. Did you catch that though? Dental hygiene. I'm not necessarily interested in learning about ethics when it comes to open heart surgery. It's just not something that I think I would benefit from or get anything out of. And I wanted to be a purpose in getting my bachelor's besides just giving me those options. I want to enjoy it. I want to learn something. I want to take something away from it. And I don't know that I would take enough away from that class for me to feel like it's something that I want to take. And then at Mankato, we have Dental Hygiene 456, Oral Medicine and Treatment Planning, which as you can see, they say that this course is designed to facilitate critical thinking skills related to drugs use in dentistry and medicine, with an emphasis placed on the impact of the dental hygiene diagnosis. And then finally, we have Dental Hygiene 441. Okay, so this one I'm of two minds about. It looks good on paper. Who doesn't want to learn more about advanced instrumentation? Ideally, when you have more techniques, you can be more skilled, right? But remember, these are online classes. So how effective can you learn advanced instrumentation online? Another side of the coin is that the pandemic probably forced a lot of recent graduates to get a lot of their instruction online. And I'm sure that they made it work. And I bet that they are competent hygienists. So I'm not saying it's not possible, but just something to think about. Okay, and I might have said I was done, but I have one more difference, and that's the dental hygiene capstone project at Metro. And the interesting thing about this is that the capstone is taught by a dentist at my current school. So I was able to talk to her. She was gracious enough to give me a few minutes of her time, and she let me know that it's a research paper and a project. And I mean, I'm not excited about doing any type of research paper, so it can sound a little intimidating. I get that, but really the idea is that you're just going to put together everything you've learned. You take the capstone in your final semester. So it might, like I said, sound intimidating, but it really shouldn't be a problem because you've got it. You've got all the knowledge, you've done the work. It's just maybe a little bit of a more complex type of project or assignment that you have to do. As I was mentioning the supporting courses for Metro, I mentioned the Writing 331. That is called Writing in Your Major. I did find a few similarities in Dental Hygiene 453 at Mankato. It's called Research Methods in Dental Hygiene, and I feel like those are similar in that the Mankato course focuses on developing similar methodological skills and proficiencies related to research and is dental hygiene focused, while the Metro course is, again, just like writing in your major, it's just way more broad. So I would be really interested in like kitting down in the dental hygiene, focus. Like, what am I here for? To get a dental hygiene bachelor's degree, Finally, one of the biggest, if not the biggest difference in these two courses or programs, I should say, is that the majority, if not all of the Mankato courses are 8 weeks long. And typically, and at Metro, courses are 16 weeks long. So for example, if I were to personally start in January, just a couple months from now, in January 2025, and I were to start by taking oral medicine and treatment planning, and then I were to follow that up with dental hygiene care and care planning, that would be the first semester, my last semester of dental hygiene school, getting my associates, coincidentally. And with everything being said and done, I would get my bachelor's in 1 year. I would graduate in May 2026. If I were to be able to waive the prereq to the prereq at Metro and not have to do that first writing class, I would be done on the exact same schedule and I would have my bachelor's about a year later in May 2026. Now, not only would I be able to finish my degree in 1 year with both of those options, I would finish with no debt and no tuition, thanks to the North Star Promise Scholarship. I don't know if any other states have anything similar to that, but it covers all of your tuition in Minnesota. If you meet certain criteria. I've linked it below along with the websites for the Mankato and the Metro State program, so you can take a look yourself. But back to the North Star Promise Scholarship, it's currently paying for my schooling right now, and I would still qualify for both of those programs fully if I were to start in the spring in January 2025. Now, if I didn't get that waiver and I had to start with that prereq to the prereq, I wouldn't end up finishing until a year later. Because of the way that capstone course is offered and you have to take that in your last semester, I wouldn't finish until spring 2027, and I would have to pay for that capstone out of pocket. It's not anything that would hold me back, but I did want to mention that way where you can get your bachelor's for 100% free. Take a look down below at that link in the description, and if you qualify for the North Star Promise, fill your FAFSA out, get your application in, and get your college covered. And by the way, if you're not subscribed to my channel yet and you're finding value in this, subscribe. Thank you. Wrapping everything up, as with all things you see on the internet, you should take some initiative and do your own research and make sure things are as they seem. I'm only a person researching what I found, and I do have a bias on what I want to do as far as what program I think is best for me. So I might have left some things out that are really important. And you should look into both of these if you decide one of them might be right and figure out which one is best for you. As always, say whatever you want to say in the comments. Feel free to ask me any questions, and I'll be back with another video soon. Bye.